do you have any tips for like staying on the positive side of that coin and not going into like the fears about the situation when it comes to finding a new job or dealing with some sort of employment issue?
Yeah. So you gave a great example of what happened. So what I want to give this general pattern that I've noticed in a lot of us. It may sound like a weird thing to ask, but when you're in a particular situation and maybe you're in an uneasy situation, it's maybe sound like you close your eyes and you can ask, how old do I feel right now? And sometimes you may notice, you might be surprised if you allow that answer to come up. You may be surprised that a younger part of you has arisen in those kind of. So oftentimes what we see when we're in chronic levels of stress and isolation that are, I like to think of our mind as having a bunch of different kind of programs, and different programs come to the surface. Like basically, for instance, like the part of me that's coming right now as we do this talk is not the same part of me that I'm with my wife. There's a subtle, shift in the way my particular programming is happening right now based on the context or the environment. In this situation, talking to you, as opposed to with my wife, as opposed to when I'm with my friends or with my parents. Different programs are called forth and you act like that. And oftentimes you'll notice this mainly also with our parents, is that we tend to kind of get into these regressed states. We'll feel like as if you're 12 years old and all these kind of things. So this regression can often happen, and you start to notice, so why am I bringing that up? You brought up a couple words in that earlier statement. You said never, and you also said forever. Things are never going to get better. It's always going to be this way. So never, always, forever. These sort of extreme absolute terms. These are the terms of a younger regressed mind. There's a lack of discernment. There's a lack of, it's an all or nothing phenomena. So you want to keep track of that when you're thinking in these sort of binary all or nothing terms and a sort of absolute like never, always. Well, could you predict what had just happened about a month ago? Most people could not do that. So how the hell could you predict that it's always going to be like this? How are you so assured with your brain right now that it's going to actually predict with this great accuracy and that it's never going to get better, considering how complex it is? In some instance, I don't want to put this, but it's almost a sort of arrogance in the mind that we could actually predict this complex situation in that sense. And in that sense, when you want to be careful of the words that you're choosing, because as you're noticing that, you can tell where you might be in that particular state. And if you're in that more kind of regress state, then it's probably better to kind of do something playful, open up the air a little bit before you start to kind of pursue these kind of things and how things are going to be overall. So I wanted to start first and foremost on that, and then we can kind of dive into the very specific areas that you wanted to go into. So you were meaning in general other parts of loss?
Yeah, so it's there's job, and then there are also parts of loss that have to do with the illness itself. So, what if a very close loved one or someone in the family gets COVID?
Mm-hmm.
There's the sort of fear of what could happen. There could just be, long-term recovery even for someone who doesn't die, and then the potential of a loved one passing away. So, what do you do when you're in that situation, maybe kind of going into it and maybe a loved one is in the hospital now, and you might not be able to see them? I can imagine it to be like an intensely scary situation.
Yeah, obviously there's no simple answer to such a difficult situation, except what I would say is, as a physician and having worked a lot in hospitals in the past, is as much as you can, if you can have that difficult conversation. My wife and I were both talking about this, trying to have it with our own parents, is that conversation of what are your wishes? What are your desires while they're healthy and lucid? Having that conversation, perhaps, talking about advance directives, living wills, those kind of things where people can be able to decide beforehand, what is it that they want? Do they want to be put on ventilation? How long would you want to be put on ventilation? Even in states where it may not be completely applicable, at least it gives some record of your wishes. And it gives your loved ones what your wishes would be when things are not so intensely scary and your emotions might get the best of you because they're so high and intense, and guilt can get the best of you, and your own kind of childhood longings of not wanting to let go. Those kind of things, all of that plays a role. So we want to be able to make the decisions when we're at our best. And so by doing that ahead of time can help ease a lot of that kind of stress of like making those decisions, because making decisions, especially if we're not sleeping well, our decision making capacity goes down and down and down if we're not sleeping that great. So you could imagine where your loved one's on a ventilator and, you know, for 5, 6, 7 days, you're probably not going to get that great of sleep. So your decision-making capacity is going to go through the toilet at that particular point. So you want to try to make those as early as possible, have that out and be there as well. And obviously, if you can do that beforehand, great. If not, you know, I would definitely, if you're sleep deprived or something along those lines, you want to reach out to as many people that you can trust as possible. Have people who can help counsel you in that regard and get the help you want, because it's difficult to be a person, especially if you don't have the kind of expertise about it as well. You know, knowing the differences, the risks, the factors, and you got different doctors, which you might be in situations where they're not really able to tell you the full kind of risk-benefit ratio that's going on there, and it's a very difficult situation. So as much as you can, get ahead of it. And number two, finding out people ahead of time. Hey, do you mind if we were in a situation, you back me up on this one, and I back you up on this one, and we'll just try to do the best we can, because that's all you can ask for. And I think that would be a great way to start.